Welcome everyone to the WASH SDG podcast, a podcast on water, sanitation and hygiene, or otherwise known as WASH. The WASH SDG program is delivered by a Dutch government-funded consortium led by SIMAVI with the WASH Alliance International Partners, SNV and Plan International. My name is Ken Caplan and I'm the host of this episode. I'm a freelance consultant working in WASH for over 20 years, focused on governance, institutional arrangements and partnerships. In this podcast series, we invite practitioners from the field to discuss some important topics that relate to their work on WASH. Today's episode will focus on the WASH SDG Innovation Fund, a fund that was established to complement and enhance the impact of the WASH SDG program and to increase the catalytic effects or spin-offs beyond this program. It provides the opportunity to test innovative approaches and practices in the WASH sector and gather evidence of their impact. In this episode, we'll talk with the three innovation projects that are currently being funded through the WASH SDG program. All three projects relate to WASH in healthcare facilities. I would like to welcome a guest from each of the projects. Putri Annisa Pramesti from SNV Indonesia, Shrawasti Karmacharya from HECAF Nepal, and John Mutebe from WASEU Uganda. It would be great if you could quickly introduce yourselves. So let's start with Putri. Can you just say a quick introduction, please?
Okay, hi Ken. Hi everyone. It's great to be here. So my name is Putri Annisa. I'm the WASH Knowledge Management Officer for WASH SDG program in Indonesia. So I also speak here on behalf of our local partner.
That's great. Thank you. And Shrawasti, if you could introduce yourself too.
Hi everyone. Hi Ken. I'm Shrawasti Karmacharya. I'm working as a program manager in this organization. And for this innovation, I'm working as a technical expert in healthcare waste management and managing all of this activity of the innovation project. So when we talk about the HECAF 360 is committed to creating a toxic-free Nepal by design and implementing clean, green and smart solution via partnership with different stakeholders.
Yeah, thank you and welcome. So John, maybe you could introduce yourself too, please.
Okay. This is John Mutebe from Uganda. I work with an organization called WASEU, commonly known as Water and Sanitation Entrepreneurs Association Uganda. We are part of the Uganda WASH Alliance and part of the Uganda WASH SDG program, supporting on service provision. Thank you very much.
Yeah, that's great. Thank you. And welcome, John, to you too.
Thank you. Glad to be here.
So let's introduce the innovation projects if we could. And just very briefly, Shrawasti, what is the issue you're trying to address and what is the innovation that you are introducing?
Okay, so the major issue about the waste, like it is under-resource sector, which is under the WASH as well, but it is not openly talked about, and it is not like waste is not properly taken care of by health facilities. They just put all different kind of waste together, which means that the infectious or contaminated waste increases. So moreover, waste is either burnt, releasing harmful toxic gases, or mixed with the municipal waste, contaminating the general waste as well. So this innovation aims to address this issue by installing the safe and sustainable healthcare waste management into facilities in Nepal, providing both the technology and knowledge. And this innovation will address this issue by offering the complete system from the segregation to final disposal in these two facilities, where waste will be segregated at source, transported safely, and treated using non-burn technology, reducing the carbon footprint as well. This system, from the segregation to the final disposal, they will reduce the amount of the contaminated waste as well. And the major problem is injury from the needles that is used for the injecting people. So the needle cutters are mandated to use, to reduce that prevalence of the injury caused by the needles among the staff. And also the major problem in Nepal and most of the Southeast Asian country, like it will contribute to stop the illegal marketing of repack syringes that will save the human health. So similarly, for changing the mindset, our team has trained all of the staff involved, ranging from support staff to the chief of the facilities. They are self-involved for the designing the system for themselves, and this will give the ownership to the system to them. Thank you.
Yeah, that's great. Thank you. No, thank you for introducing the project. And John, what about you? What's the key challenge or the key issue that you're facing, and what's the innovation that you've been introducing with your colleagues?
So the key challenge here is we have low functionality of basic WASH infrastructure at most of the health centers in Agago district. So you find that one of the WASH infrastructure is broken down, and due to lack of enough resources, it is ignored or it is just left there. So our innovation is basically focusing on lack of alternative revenue streams to finance the routine maintenance of critical WASH infrastructure. So we are finding various income resources, things. The approach is innovative in a sense that it seeks to tackle the key bottlenecks that is limiting the involvement of the private sector in the maintenance of WASH infrastructure at health facilities in Agago district. And we utilize issues of resource mobilization, internal resource mobilization by the health centers. We look at monitoring these WASH facilities using the WASHFit digital tool. And we look at utilizing the already little resource by the health facility in a better way. So it's literally changing the mindset of the health center and showing them that they have local entrepreneurs around the health center that they can utilize instead of sourcing service providers from distances that are very far, who are very expensive. So source the nearby local entrepreneurs who are nearby, who we have trained, then also utilize the necessary resources that they have by utilizing income generating activities, which we have introduced to them, and also supporting entrepreneurs to set up businesses that are related to the health center that will generate some income for operation and maintenance for those WASH facilities in that area.
So it's not just a financial response, it's also a technical response
Yeah.
too.
Yes.
Yeah, great. Thank you. No, thank you for the helpful introduction. And last but not least, Putri, you're working on a project in Indonesia. Is the challenge similar to the other projects?
Yeah, so here in Indonesia, we also face similar issue. So also based on our SNV baseline data, that in the city that we are working in, like over 80% of toilet in the primary health center is fell under unimproved classifications, yeah, which is meaning there's limited gender segregated toilets and suitable toilets for people with disabilities among other. And also, there is no alignment in defining what constitutes a good wash conditions in the national level monitoring system, in the local, and also in the joint monitoring program, like the global standard. So, as you are working in the primary health center, which is the closest institutions to the community that is responsible for the promotion of health and the hygiene behavior, but ironically, there is rarely a feedback mechanism in place. So we aim to strengthen the accountability mechanism between the primary health center, between the community, and also the city health office for better responsiveness, like stronger service delivery arrangements, and also to improve the wash in primary health center. So to achieve that, our strategy is to set up structures for conversations and alignment between the stakeholders, between the primary health center, the health office, and the community to allow transparent information to all parties. Yeah, so such open process, we believe, will enable people power to create demand and to be responsible for their own wash improvement. Also, in this platform, the health office as duty bearers and the primary health center as service provider could demonstrate their strong commitment in improving wash service delivery.
Yeah, great. Thank you. Just Putri, just one quick question for you. I mean, is this setting up these multi-stakeholder platforms? Is that do they do that in any other sectors in the areas that you're working in waste management or in education programs or other things, or is this kind of new to the area, this approach?
This is actually new for the wash and primary health center area. Indeed, because we two-level structures at the city level, the wash forum multi-stakeholders, and also at the primary health center itself, the wash working group. So this has never been done before in any of the healthcare facility. So this is a new innovative approach. During this area.
Yeah, great. And like we said, you're not familiar with any other sectors doing this in in the area, like the education sector or the waste management sector, others where they've created,
No.
people's voice mechanisms? Yeah.
Yeah, I think we don't have that here
Right.
for that.
Okay. Yeah. Interesting.
Setting.
So it really is introducing something completely new in the area. That's great. And then let me turn to Nepal again, Shrawasti. Innovation and change, they often bump up against a lot of reluctance from different stakeholders. How have you? Firstly, did you have any reluctance to change or to innovate from the groups that you're working with, and how did the project kind of overcome them, if you did?
Yeah. So I've been involved in this project since the beginning. So it was not that simple and easy to convince the people. And moreover, the people really don't care about the health service in the facility. They will just focus on the health services. And though it is true that health facilities are frequently monitored by the federal government on the basis of minimum service standard that I've already mentioned, implementing a waste management system is not like it will not happen automatically or naturally. At the initial stage, like we needed to receive the approval from the different authorities to start the project, but this process was so lengthy. Moreover, we struggled to obtain the buy-in from different stakeholders like local government, project health facilities, as well as the provincial government also. And similarly, it took a long time to convince the hospital management and provincial government for resource allocation due to the frequent transfer and our like Nepalese political instability. So that was a great challenge for us. But in order to understand that urgency, this innovation-oriented and sensitized people of all level of government in the health sector in Nepal in need to give them the clear picture of the need of healthcare waste management, and the on-site trainings also motivated the staff to think about the changes and new system to be adopted. So yeah, we overcome that till the date. Yeah, thank you.
So it sounds like it took a while to kind of convince people, but ultimately it looks like people have come on board, and it sounds like you've got a model that you can apply to that can be replicated across other parts of Nepal. Is that right?
Yeah, Ken. So this is a part of our innovation as well.
Yeah, that's great. No, thank you. I mean, we'll be keen to kind of follow that as you go forward to take the project further to replicate it. John and Putri, what about you? I mean, John, did you face kind of problems of kind of reluctance or hesitation from some of your counterparts in other institutions?
On our side, the Innovation Fund project is a learning project. It's a project that is experimenting with doing things differently, and that comes with very many challenges. The biggest challenge that the project has faced is the expectation of receiving free things as usual. And this is prevalent in Nagago district. We are, however, glad that at the beginning, this is beginning to change. There's also, at the start, they did not understand the concept of the project. And we started with a team that has since changed. So we had to keep onboarding the team in these various health centers. So first of all, the concept is unique, and also changing their mindset is something that we are working on. There's a point where we had to first stall the project so that we get everyone on board to understand the sustainability of this innovation. So it's basically a mindset shift, and challenges of receiving things free is something that has to change, because not all those things that are free will continuously be there. They will end at one point.
So John, just quickly, do you think that you're at a point now where others are starting to pay attention, other health centers and the government are starting to pay attention to what you're doing, and they might seek to replicate it themselves?
Yes, I think there is some attention coming through, and they want us to engage in a national dialogue in the next few months to share some of the challenges that the health centers are finding, because at times the system also affects the innovations. For instance, the procurement processes do not allow local entrepreneurs that we are sourcing in the vicinity to engage in service provision for these health centers. something to talk about at the national level with the Ministry of Health and Ministry of Water. And these are the things that we want to discuss. And if some of these policies are changed, it could easily be scaled to other health centers.
Yeah, that sounds really promising. Yeah, and good luck taking that forward with the different levels of authority in the government, etc. What about Indonesia? What about Putri? What kind of problems have you faced in terms of launching the initiative, taking the initiative forward, promoting change of mindsets like John was talking about?
Yeah, as you mentioned earlier, Ken, that changing is really close to like hesitation from the other parties. So we did actually encounter a rejection from the primary health center, particularly because we tried to introduce this multi-stakeholders, right? The multi-stakeholders forum, which involve many stakeholders. Because usually the WASH improvement in primary healthcare, they usually work in silo. So it is really a new thing for the primary health center. And also, as I said, that we are involving the external parties like the community and the media. The primary health center also has this perception, particularly in media, because media is tend to bring up negative critic. So at the beginning, they're really hesitating, actually, the primary health center. But then we believe that the media is also a strong catalyst for a good change. So we try to push that involvement during this whole process. So to overcome that, we invited the media to be present in all process of the primary healthcare. So then eventually the primary health center built trust to the media because they share like writes an article of the improvement and a good or positive articles about the primary health center. And also the other thing is we are engaging with the top level decision maker such as the city mayor. So then we get the necessary political backing for this project and also the commitment needed to run out the project. So it's also involving the local government as well to support this project as well.
Mm-hmm. So just so I understand correctly, I mean, was the media skeptical at first and then they kind of came on board, or how did that work?
No, it's actually the primary health center that is skeptical that the media is involved because they are afraid that the media will write or share news about a negative issue or like critic to their facility. But no.
Okay, but then the healthcare facilities have come along and kind of see the value in what you're doing, as well as the local governments, yeah?
Yeah, exactly.
Yeah, that's great. No, that's, again, sounds really promising. And I mean, if we talk about replication, so you think that there other people are starting to pay attention in other municipalities and other geographic areas to take the model on board, or?
Yeah, we're actually ready to scale up because, as I mentioned earlier, also we try to get the top level decision maker to engage in this project. So we actually get the one of our city, the metro city, the city mayor already shared their commitments, and also they already allocated budgets for replication to another primary health center for next year. So yeah,
Wow.
their budget allocation like increase 20 to 30% for the WASH improvement in primary health center. So we are ready to scale up. In terms of the other city, although the city mayor is not as engaged in this as the other city, but then we can already see the other primary health center, the good news that shared by the media. So they are interesting to also get this kind of project for the WASH and healthcare improvement.
Mm-hmm. And I mean, in terms of milestones, if I understand correctly, WHO Indonesia had good things to say about the project too. Can you tell us a bit about that?
Yeah, we're actually very proud that our innovation project, the social accountability mechanism for WASH and healthcare facility, was acknowledged as a model approach by the Ministry of Health and also by the WHO Indonesia. So the WHO Indonesia also mentioned that out of 200 healthcare facilities that adopted WASH-FIT, like the metro city, one of our pilot city, has progressed the most and inspired them visit metro to document its story and share it globally. So yeah.
Yeah, fantastic. No, that's really great. I mean, that's kudos to you for getting on the map, and it's great that WHO Indonesia has recognized the project as well. So, yeah, well done. And I mean, John, in terms of the project in Uganda, you'd mentioned that there is kind of increasing attention to the project and that others might be interested in scaling it up too. What's been the relationship to the Ministry of Water and Environment?
I think it's just our relationship as an organization with these entities. But as my colleague has said, they're in silos. Ministry of Water and the Ministry of Health sometimes don't connect. So we want to see if we can have a dialogue where both entities and sectors are together with the district authorities of Agago district, plus the health center in charges. We discuss what the challenges are, the bottlenecks, and see how we can get our innovation to scale with those discussions.
Yeah. Okay. So a lot relies on that kind of forging those dialogues across different stakeholder groups. It sounds. Is that Shrawasti? Is that the same for you in Nepal?
Yes, Ken. This project will be finalized in coming month, but at the same time, we have already receiving the request from other partners to replicate and scaling up our experience as well. So when we discuss these issues with the local government, these two municipality that we are working with, um, we have received the commitment for collaboration for improving the waste management practice in these municipalities, and the model sites that we are implementing, in which we are implementing the system, will be serves as a hub center for managing the waste from the other health facilities in the same municipality. So the private sector, including the private clinics and labs, has also shown the willingness to pay for the service that will be provided by this hub center. So local government is also allocating the budget for replicating this system in their municipality in other health facilities. And nevertheless, like HECAF 360 is being advocating for replication of the system throughout the country by showcasing this center of excellence in both of the municipality. And we are trying to bind the relevant stakeholders to integrate these, what we are talking about, the remote monitoring system in the technology in a national system also. So we are planning for the open forum discussion for the system to be replicated to other facilities as well. So we are trying to showcasing these models in the province to convince the province to have a long-term plan for the waste management in the province. Yeah, thank you.
Yeah, that's great. I mean, it could really change the landscape of waste management, not only in healthcare facilities, but more broadly in the country. That's really impressive. Yeah, thank you for your efforts on that. Look, I just wanted to say a quick thank you to John and Putri and Shrawasti for all of your inputs today, and also for the good works that you're doing. It's really encouraging. Just in terms of some of the main messages that I've heard, it's really about changing mindsets, but it takes time, it seems, and relies a bit on dialogue across different stakeholder groups so that different perspectives can be heard and different ideas can be put on the table. So thank you again to all three of you for your contribution today to this podcast. I really appreciate that. Happy to hear that all the projects are so successful and ready to scale up. So just to say thank you again, and this is the end of this podcast, but I hope you enjoyed today with John and Putri and Shrawasti. Thanks for listening to this WASH SDG podcast. Make sure to share this episode and follow the WASH SDG partners on social media to stay tuned for the following episodes. If you haven't listened to our previous episodes on menstrual hygiene management, IWRM, or toilets, please check them out. We're looking forward to seeing you next time at World Water Week. The WASH SDG podcast is a collaboration of WASH Alliance International, led by SIMAVI, SNV, and Plan International Netherlands. And this is all possible thanks to the Dutch Ministry of Foreign Affairs through the Inclusive Green Growth Department. Thanks everyone, and take care.